Hello, everyone, and welcome to the webinar, Evidence-Based Practices for Integrated Behavioral Health, Applying Motivational Interviewing, Part 1. My name is Leah Sims, and I'm the Project Coordinator for Practice Improvement here at the National Council for Behavioral Health, and I will serve as your moderator this afternoon. Before I begin, I'd like to cover a few housekeeping notes. Today's webinar is being recorded, and all participants are currently in listen-only mode. You can find the call-in number for the webinar on the right-hand side of your screen. Please make sure to enter your audio PIN, also provided with your call-in information, in the GoToWebinar window. You may enter your audio PIN at any time during today's session by pressing pound, followed by the audio PIN number, and then pressing pound again. Entering your audio PIN is the only way that we will be able to unmute your line. If you have a question or comment throughout the presentation, please use the raising hand icon and we will unmute you. Alternatively, questions can also be submitted throughout the webinar by typing your question into the dialog box to the right side of your screen and sending it to the organizer. Depending on the question, we may type an answer back to you, interrupt the speaker to ask it, or save it for the end. We'll answer as many of your questions as time allows. Following the webinar, we invite you to please complete a short survey. An audio version of the entire webinar and a PDF of the presentation will be emailed to you by the end of the week. If at any point during the webinar you experience technical difficulties, please call Citrix Tech Support at 888-259-8414. And without further ado, I'll pass things off to Pam.
Great, thank you, and welcome everybody to our webinar today. My name is Pam Pietruszewski. I'm an integrated health consultant with Joan King, whom you've all been working with at the National Council for Behavioral Health. In fact, today I'm in Helena, Montana, with Joan, although Joan is down the hall in a meeting, but we are in your beautiful state doing some of our work with the Integrated Behavioral Health Steering Committee. It's a lovely day here in Helena. I hope it is in your part of the state as well. And this is part one of, there's going to be two parts of doing some motivational interviewing training of sorts. I'm going to do my best to make it interactive, give you a chance to think of how you might respond in different scenarios to the patients or the clients that you work with who are experiencing or interested or maybe even resistant to change, and how you might be able to enhance their motivation. So I wanted to start with a polling question. I've got several throughout the presentation, but I wanted to start with understanding, for those on the phone or on the webinar, your experience with motivational interviewing. So Leah's going to launch the question, and I'm wondering if you could choose from one of these options. You've had no experience, this is really your first exposure to it, or you've had maybe some training in the past, but it's not necessarily something top of mind that you use, but you know what it is. Item C would be that you use it some, and item D would be if you feel you use it every day in your encounters with people experiencing change. So with that, Leah is launching the polling, and Leah, let me know if I need to do anything different on my screen, or maybe it's just I'm not seeing quite what you're seeing.
Yep, it's launched.
Okay.
So far, we've had a bunch of people answer, and I'll go ahead and close it right now. So if anyone wants to quickly get their answers in, you can go ahead and do that. And I'll close it right now. And there you go. Pam, can you see the results on the screen?
No, I don't. So if you can just let me know what it is.
Sure. So 33% said none. 17% said I've had training in the past, but using it isn't top of mind. 17% said I use it some, and 33% said I use it every day. So there's a tie for none, and I use it every day.
Okay. So a little bit of majority on either of the ends of none at all, or I use it all the time, and then a little bit in the middle. So good. I hope to meet all different levels of interest and experience with this. I do find that motivational interviewing, well, first of all, what the research shows is that a one-time training doesn't make us proficient in it. It really takes repeated or multiple trainings along with feedback and coaching. So I myself get to as many trainings as I can too, because I pick something new up from different trainers, or I'm at a point where something just sticks that I maybe did hear before, but it's just something about the way it's presented fits for me. So I'm hoping to reach all levels with that. Okay, so my next polling question is perhaps a little bit silly, but work with me on this one. This question is, my own motivation level is A, always rock bottom low, B, it goes up and down depending on the day and the circumstances and such, or C, it is always sky high. I will give you a moment to respond to that one.
So Pam, it looks like we have 85% voted. We have 86% says it goes up and down depending on the day, circumstance, etc. And we have 14% said it is always sky high.
No one wants to admit it's sometimes rock bottom low. No, this was really just meant to be a silly question, and because point being that most people, our motivation changes all the time. Motivation is essentially not a static thing. It does vary. It's wonderful that we have some people that can say that it is always sky high. And this is true for the people that we work with as well. That we might see people that we really only see them at times when they have low motivation, hence the reason they're perhaps coming to see us, because they need help thinking through their health condition and what they could do. And at the same time, we want to be able to think that there are times where their motivation is higher. And the whole goal of motivational interviewing is figuring out how to tap into that and knowing that people, as much as they may seem stuck, that really in general motivation does vary. The next slide is kind of a visual example of that, if you will, that you know, when it comes to change or feeling motivated, you know, sometimes we find ourselves or our patients getting on the ramp after, you know, not being on the road at all. At other times, we think everything's lining up and they come in crisis and they're suddenly diverted another direction. And we wonder, what happened? I thought we were on the right track. And we use language like that a lot, right? Just get on the path, or once things are on track. And this is a visual depiction of how motivation is really ever changing. And at times sky high, and maybe at other times rock bottom low. And so we have to figure out how to work with people where they are. The next slide is a reminder that motivational interviewing does correlate with the stages of change to some degree. The stages of change, and I like this depiction of it because it reminds us that it isn't linear, hence similar to that last slide, that, you know, a person can go from pre-contemplation, which is they're not even aware that there is a change that could make things better. And once they become aware, they might jump right to action. If circumstances are right, if the drive and the need is there enough, it might have just been a lack of awareness. We might have someone else that's been in contemplation or thinking about the change for a really long time, and we're not quite sure what it's going to take to move them into preparing or then into action. So people can move both, you know, forward and backwards, and they can skip steps. That's something we've learned over time when it comes to stages of change. And so the point of using motivational interviewing is to be able to recognize where we think someone is at and then meet them where they're at, and hopefully with the right rapport and the right trust building, be able to help them take the next step, or maybe we take a half a step forward and see if they will respond to that and work with us. So stages of change correlate to some degree. Where I tend to hesitate to say too much about stages of change in this context is that I think we can also get to where we might label someone as being in a stage and thinking that they're only going to stay in that stage, you know, unless something big changes, you know, to say, well, you know, this person hasn't shown up for the last couple of appointments. They're obviously not ready to change, so I'm not going to do anything, and they'll come back when they're ready. Motivational interviewing takes a slightly different approach and says, yeah, they may not be ready. So what can I do? What can I ask them? What can I elicit from them to help them think through what it would take to become ready? So I wanted to provide you a definition. If you haven't seen one before, it wasn't until 2012 that Miller and Rolnick, the authors of the motivational interviewing strategies, came up with a definition. So what it is a collaborative and person-centered method. It's a guiding method that is to elicit and strengthen motivation for change. So it's a collaborative conversation, and me thinking that it's person-centered means it isn't about me or what I think would be best for this other person. It's really continually coming back to inviting the other person to give their input, or asking the other person what they think would be useful, or investigating what could get in the way of making a change. Staying very person-centered, not clinician-centered. The guiding method part of this is to say that we are intentionally and transparently helping the other person think through the potential for change. So this isn't something we try to do in a sneaky way or a manipulative way to get a person to change, nor is it where we are sitting back and having the other person completely design and decide on the change. We do want to partner with them and guide them in a person-centered way. I like to add a little bit here about the social determinants of health. If you're not familiar, this is some research that has been going on around what is it that makes a population healthy, or what contributes to our health as a population. This really speaks to me about the power of something like motivational interviewing, because as you can see, if you look at the different percentages of what contributes to our health as a society, genetics plays a big part in our health, but medical quality and availability is actually a pretty small slice of the pie. Social circumstances play into that, our environment and the toxins or pollutants in the air. But the biggest slice of pie of what contributes to health is our behavior. And motivational interviewing's goal is to help a person with making decisions about behavior and the things that can be controlled or influenced. So our behavior, our lifestyle choices, it's all the things we all know, right? Diet and exercise and substance use, stress and relationships have a behavior component, and motivational interviewing tries to help us think through the behaviors that we are acting upon or considering in order to be healthier people. So what motivational interviewing is not, and by the way, when I use MI in this context, it is for motivational interviewing. I know it also is mental illness or myocardial infarction or probably a lot of others. So MI in this case is motivational interviewing. What it isn't, just to be clear, is it's not a trick. It's not something sneaky we're doing behind the scenes to someone else, nor is it a specific technique. It isn't one thing. There's no one magic bullet that makes MI work. It's really not about problem solving or helping the person build specific skills. Some of those might inherently come out when it comes to making decisions or thinking through the pros and cons, but in and of itself, it's not problem solving. It's not telling the person what they could do or providing a solution. It's helping them think it through. It's also not easy to apply. It's fairly easy to learn, I would say, and a lot of people that come to the trainings that I do will say, this makes sense. Yep, it's not rocket science, or, that's logical. Where it gets tricky is when it comes to the application. So thinking through and listening carefully to what the other person says and being thoughtful in how to respond in a way that will enhance their motivation. It's also not a remedy that works everywhere, right? We have to think through, am I in a situation where there's a potential to help this person think about change? Am I in a situation where it's a crisis and this person isn't wanting to sit back and think about the pros and cons? They know they need to act. Or they're specifically asking me for information about, a new diagnosis. There are still elements that we can use in MI but it may not be appropriate for every situation. So what do we know about MI? We do know that there's a lot of research. There's more than 30,000 articles that have been written about motivational interviewing on a range of behaviors, from gambling to diabetes to dental procedures, asthma, family violence. It started in the addictions field and has since been studied in a number of different clinical conditions. Now, the second bullet is important to acknowledge, though, that outcomes, use of MI, and the efficacy it is varied. There's a lot of different research and papers. One paper will say this worked, another one will say it didn't stick, another one will say it was mildly efficacious. A lot of that has to do with the quality of training or the ability to get that ongoing feedback and coaching. As I mentioned in the beginning, more than just attending a training, it's about using it repeatedly and deepening your experience with it and watching the client or the patient for how they respond to know whether you're moving in the right direction. It is reliably measurable. There are some ways to code the responses. Some people will submit audio tapes of interactions in order to get feedback from a trained MINT person, a motivational interviewing trainer. It's MINT, network of trainers. We also know that it's pretty culturally relevant in the way that there are some interesting studies that speak to different cultures, different age groups as well, kids versus adults. Generally speaking, because it is about meeting the person where they're at, using their language back to them in a reflection, and sometimes following their leads or really making sure you are in partnership, that's where the cultural relevance comes in, because you are tuning into the other person's beliefs, the other person's strengths, the other person's reasons or ability to make changes. And above all else, beyond any, what we don't want to call technique, but beyond any of the particular strategies or things you might try and say, I know that's an MI type thing, it's still all about the therapeutic relationship and having a genuine relationship where there's trust, where there's the ability to listen to what the other person is saying is really the bottom line. None of the other stuff will be as effective if it isn't for that therapeutic relationship. All right, so there are 4 basic processes that happen in a motivational interviewing conversation. Very intentionally engaging is the first step, and as I tried to do with my colors here, it's something that has to happen throughout the whole conversation or visit. As I said earlier with the therapeutic relationship, if we don't have an engaged person in front of us, or we aren't feeling engaged, we really can't go through the other steps. So we have to be constantly attending to that engagement. Meaning, is that other person alongside? Are we alongside? Are we reading them enough to know that they are at a certain stage of readiness? Maybe we take a half step forward and see if they move with us. But if they're not ready to move there and they start to disengage, we've got to go back and revisit that. Once there is engagement, we can do some focusing around what is the change interest, or what is the readiness, or what is the change opportunity, and then evoke from the person what they would want to do about changing versus telling them how to change. And then the final step is planning, really the final step. And I know in busy healthcare environments, this can sound like, wow, this is going to take forever to get to that point. And we know we've got to have a care plan in mind, and we've got to have them sign off on what they're going to do next. But this doesn't have to take a long time, and we can pretty quickly go through these steps, and they don't have to be linear for that matter either. But we can evoke and ask, and the other person might be really ready to focus on some of the issues. But the first 3 are the most important. Planning may or may not come in the session. It might come after the person thinks about the things we talked about and then has their own plan in mind. So it's really about those first 3, if nothing else. Just a couple things here to say about the spirit of MI, and then I'm going to have another kind of polling question for you. So this is this is the heart of what it is to do motivational interviewing. So without these 4 things, anything we say beyond this point may or may not look like MI or be MI if we're missing any of these 4 components. So the first 2 in here, compassion. Compassion is that we really are believing that the other person's needs come before anything else. And that can be really hard to do if we, in our own clinical judgment, feel that a certain course of treatment would be best. How do we show and talk about that while still maintaining compassion for the other person's challenges or barriers, or maybe, that quote-unquote resistance? So compassion is one piece of it. Partnership is the next one, where, in the case of, knowing that there's a certain treatment that would be best, we want to partner with that person and say, I've got some ideas and I can provide you with some clinical information about what we know is the best treatment for this condition. Would you like to hear about it? Or may I share that information? And then I'd like to hear from you what you think. That's a way of showing partnership, where I'm an expert in this, topic of diabetes or substance use disorder. But you, the patient in front of me, you're an expert in you. And I value that equally and hope that you will contribute that expertise so together we can figure out what will work best. We know that when people feel compassion and partnership from their care providers, they're more willing to hear them out, and they're more likely to be engaged in the care, which is what it's all about, right? And then the change can happen. The other 2 pieces here in the spirit are acceptance and evocation. And evocation is the drawing out of the other person, like the drawing out with the straw, the lemonade or the iced tea. It's the drawing out of from the other person. What would be most important to them? What are they most concerned about? What would be good about, taking this new medication? And really finding out from them and having that inherent belief that they've got what they need and they're the best judge of what is going to work for them. And maybe they haven't always demonstrated it, or maybe, they don't even believe that in themselves, but it's constantly coming back to, I do want to know what you think about this, or how could we go about this together? What might be the next steps? Those are all ways of evoking from the other person. Acceptance is the last part of the MI spirit, and what that is about is, well, what it is not is, it's not about saying, yeah, well, it's your life, whatever you decide to do, that's fine. That kind of statement actually lacks compassion. So acceptance is more of saying, I'm here to help you think through what your choices are, and ultimately the decision you make is the one you're going to make. And, from there we'll have to figure out what comes from that. If you decide not to follow through on this medication, what would that look like? And that's where evoking can be a good partner with that accepting. Having the other person think through without us telling them, if you don't take that medication, you're going to die. That kind of statement doesn't usually motivate someone to change. It might initially, be enough of a scare tactic that the person says, oh, I've got to do this. But what we're looking for is that deeper internal need and desire for change. So thinking through and allowing the space for the other person to make a decision that they feel is going to fit best for them. Okay, so with these 4 types of spirit in mind, I have a scenario for you. So say your client says, I know I need to get my life back on track, but I'm so overwhelmed right now. What do you think I should do? And you as the clinician say, I have some ideas, but first, help me understand, what have you already considered? So I'm wondering if you could take this poll and tell me, does this clinician's response embrace the MI spirit? And the choices are yes, absolutely, nope, does not, or somewhat. I'll give you a moment to give your response to that. So again, the client says, I'm overwhelmed, I need to get my life back on track, what do you think I should do? And the clinician says, I have some ideas, but first help me understand, what have you already considered?
So Pam, we have 79% of people voted, and I will close it so everyone can see the results. And it says 73% said yes, and 27% said somewhat, and 0% said no.
Okay, great, really great. I know it's always tricky on a webinar to make this more of a dialogue, but I do want to make sure that you have opportunity, if you'd like, to do that virtual raising of your hand. We can unmute phone lines if anyone would like to speak to why they chose the answer they did, or you can use the chat box and give some context to your response there as well. I am glad to see that no one said no, because I think there is, in this clinician's response, some MI spirit. The fact that they've elicited or evoked from the other person what have they already considered is a nice example of giving that expertise back, right? So even though the client said, what do you think I should do? Boy, that can be really tempting to say, this is someone that's ready for my advice and they want my input. Before we jump to that, motivational interviewing recommends that we evoke from the other person. So as the clinician did here, what have you already considered? Because that can be really helpful in understanding what the person's already tried, what they've been thinking most about, what they've already decided is not something that they could do. And then when you do give your advice, you can do it in a maybe more tailored way. You can speak to perhaps what they're most interested in pursuing. I don't know if I can see anything in the chat box, Leah, but please stop me if someone does have a hand raised or have contributed anything in the chat box.
Okay, yeah, we don't have any hand raised or anything in the chat box, but I'll let you know if anything comes up.
Okay, great. Yeah, so really the point of this one is that, for the most part, this person is saying, what have you already considered? And yes, I can provide some ideas, but I first want to hear from you, because that's, if we're going to make something work, we want to know what's going to work most for you. Okay, I think I have one more scenario. Let me get, yeah, I do. Okay, so the next scenario is that the doctor, the patient says, the doctor just told me I have to quit smoking and lose 40 pounds or I could die. I'm tired of her scare tactics. It's my life. And the clinician's response is, well, we all want what's best for you. Should we talk about smoking reduction or weight loss strategies first? So same question for you is, does this clinician's response embrace the MI spirit? Yes, no, or somewhat? And you may not see the full scenario when we switch, so I'll reread it. That the patient says, the doctor told me I have to quit smoking and lose 40 pounds or I could die. I'm tired of her scare tactics. It's my life. And the clinician's response, that you're thinking about MI spirit, well, we all want what's best for you. Should we talk about smoking reduction or weight loss strategies first?
Okay, I'll go ahead and close the poll and share the results. So it looks like 11% said yes, 68% said no, and 21% said somewhat.
Great. Yeah, I'm glad this one is split, because I think this one does give us some pause for thinking that, sometimes it's really obvious that the spirit seems to be present or not. And other times it's like, well, that part was good. I'm not sure about that other part. And really what this is an acknowledgement of is that, this is where the applying MI gets a little more tricky. Every person's different. I find a lot of differences in different parts of the country. I do a bunch of work in the Bronx, and I'll tell you, a lot of the staff that I work with will tell me, you know what, my clients just want me to give it to them straight, or they don't want all this touchy-feely stuff. Now, I don't know if we can just say across the board that's true. My experience of being in Montana is that we've got really nice people here. people that maybe would want some more of that, paired, shared decision-making type thing. So point being, sometimes this isn't just there's a one yes, no, it's not that simple. So let's deconstruct this one a little bit. And again, I welcome you to do the virtual raising hand or entering in the chat box. The clinician's response of, we all want what's best for you. What I often hear with trainees is that part feels a little not so good, like they're not really hearing out the patient, that they're just kind of placating them and saying, yes, dear, patting of the hand. We all want what's best, that it's not real genuine. So for some people, that's why they choose that no response, that's just not fitting the bill. Now, the second part of this, should we talk about smoking reduction or weight loss strategies first? Some people have said, well, I'm seeing some of the MI spirit there because they're giving the person a choice. They are eliciting or evoking from them what they might want to work on. And, generally speaking, that is the right idea, right? That versus us coming in and saying, okay, well, gosh, you got to quit smoking and lose 40 pounds. Well, the research says you should start with this one. Or, we've got a great cessation specialist on staff, so I'm going to recommend you see them about your smoking. That's where it starts to lose the MI spirit because we're suddenly telling the person what they should try. So this response from the clinician might feel like it's not so bad because we gave them some choices. Where people still have said, that might partly be true, but I don't think it's enough of the spirit, is because, similar to the first sentence, it's kind of breezing past this patient's concerns. This patient is saying, I'm tired of the scare tactics, it's my life. The best response in an MI way is to first acknowledge what this person is saying. Something like, wow, you just got some information from your doctor and you're not sure what to make of it. Or, you're really frustrated that it feels like the doctor is using scare tactics. Or just acknowledging it is your life and you do have some choices, right? So none of that is saying, gosh, you can ignore all that advice, but it is starting to engage with the person. And again, that's that first step. If we don't engage with them and we move right into where do you want to go with this change, they're probably not going to do it because they're not feeling heard. So that's the point of that one. Thank you for playing along, everybody. The next piece of learning motivational interviewing, and for those that said you use this every day, this is probably very familiar to you, is the ORs. These are the strategies that you might employ at different times and different combinations to help someone think through change. So I'll say a few things about these. The first one is open-ended inquiry. This is asking questions in a way that you're not looking for just simple, quick, yes, no, maybe type answers. You're actually trying to understand the other person's experience. You might do this in a way of saying, could you tell me more about what that's been like for you? Or give me an example of a time when, things were really going well for you and you felt good about, the weight that you were at, right? So it's getting the person to elaborate. It's also questions or sentence stems that start with how. How has it been for you? Or, what's a typical day like for you as a person that has diabetes? So it's better understanding the person's experience without just asking these quick yes, no questions, because then we're not really getting a lot and the person tends to be more passive. So some examples of what this looks like. So number one, instead of asking, are you still checking your blood sugar? What are we going to get when we ask that? They're going to say, oh, yeah, or kinda. And we're really not finding out much about that process. So the alternative would be to say, how do you check your blood sugar? Tell me, your process of checking it. Because we could find out a whole lot more then, right? Well, I always forget, if I'm supposed to be fasting or if I should do it right when I wake up or if I should do it 2 times a day or, I don't even know if I'm getting enough blood when I prick my finger. That's really informational. That's what we're trying to ask in an open-ended question. The second one here is instead of why aren't you following the treatment plan? Now, that isn't necessarily a terrible question. We might uncover some reasons why they're not following it. The reason I use it as a not so good is because oftentimes why questions create a defensiveness. Now, if we're engaged with this person, we have a relationship with them, there's no reason we couldn't do a why question if it's delivered real sincerely. Sometimes, though, it causes that, hesitancy and the walls to come up. So the opportunity instead could be, tell me about the treatment plan. How does it look for you day to day? Again, wanting to understand the person's experience in a broader way to better think through what's going well with the treatment plan, what needs tweaking, what are they not following without just blatantly saying, what are you not doing? It's a different way of finding information. With the next two, what I'd like to do is have you type in the chat box some open-ended alternatives to how these are presented on the screen. So you could, if you're going to answer number 3 or number 4, either type 3 or 4 with your chat response. So instead of question number 3 says, will you go to the support group? I'd like to hear from the group today. What are some other ways of asking that in a more open-ended way? And at the same time, you can try number 4 as well. So that says, don't you want to see your grandkids grow up? So I'm looking for open-ended alternatives to those 2 questions, which, again, number 3, will you go to the support group? The person that just wants to get out of your office and get on their way, oh, yeah, I'll do that, right? We want to better understand what's really going on. Or number 4, don't you want to see your grandkids grow up? Hopefully we're not saying that in that way, because we know what could come from that. Yeah, what do you think I am, an idiot? Or, well, yeah, but you don't get it. My life is really stressful, and it's really hard to manage all of this, right? Any of those things might make it a little harder to have a good conversation. So hopefully a few people have taken a stab at, and I'll even say this, Leah, we don't have to say who. If you want to feel more comfortable about trying some alternatives, but curious to hear some other ways of asking those questions.
And let me know when you're ready for me to read some of the answers.
Yes, let's go for it.
Okay, so here are some answers to number 3. Some of the answers are, what are your thoughts on attending support groups? What interest do you have in attending a support group? How do you feel about going to a support group? Tell me about your experiences with the support group. What benefits do you think you would gain from going to a support group? And what are some pros and cons of attending a support group? And then we also have a few for question number 4.
So wait, actually, Leah, let me just say a few things. Boy,
yeah.
I think we can just close this up now. You guys are awesome. Really good examples, really good, right? What you're getting at is, what are your thoughts? I heard, tell me about, right? And this doesn't mean we want to, necessarily get backlogged. We've got busy appointments. We've got a lot of people we need to see. But just one question, inviting them to speak to this idea of a support group can help you so much with matching them up with the right support group, figuring out a different treatment plan if that's not going to work for them, finding out that, they went once and it was not the right fit, or they got lost, or there's not a bus route to get them there. These are the kinds of things that can help us problem solve and help people actually reach their goals or understand that, maybe the goal we set isn't the right one. So wonderful examples. Okay, now let's hear number 4.
Okay. One person said, what do you imagine your grandkids will be when they grow up? And then someone else said, what are you looking forward to while watching your grandkids grow up? And then the last one is, what do you see your involvement with your grandkids as you grow old with them?
Beautiful. Very nice examples. I really like that, because what you're doing is you're, again, trying to understand the other person's experience. And this is so much more about them, right? I mean, that's what makes this person-centered, is, asking about, with the other question, what would be the benefits, or what interests you? Because, we want to see if they can see some of the positives to going to a support group, to seeing their grandkids grow up. And where the research really shows motivational interviewing works is in the other person expressing the reasons or the desire to make that change, not anything that we say. So, it might short term if we say, there's a lot of benefits to the support group, X, Y, and Z. Yeah, you might get a person here or there saying, oh, okay, I'll give it a try. But you get the other person speaking to why they might attend or what would be wonderful about their grandkids. That is way more powerful because it comes from inside. And that's where change and motivation really comes from. So you guys are getting the right idea. Thank you for playing along with that one. A few more things to talk about with the ORs is the A. So we had O. Now the A is affirmations. Now these aren't just compliments or, wow, you seem very smart. It's really, we're trying to get more testaments of their character. Reinforcements, things that can help them think through how they might accomplish change. It also shows that we're starting to kind of understand them. And we, sometimes can give an affirmation just after a very brief meeting with them. Sometimes we don't know them very well. So there's a couple ways to go about this. This is a list, and I think you guys get the slides after so you can have this. This is a list that comes from the Motivational Interviewing book where they studied people that had successfully made changes, and these were the types of things they attributed to their success, things about themselves. So if you've noticed in even just 10 minutes of working with somebody that they are just really flexible when it comes to, figuring out how they can get the next appointment to work with you. Maybe you could say, boy, you seem very flexible. And then maybe you talk about, they say, yeah, I know that you got to roll with it because I know that it's really hard to get an appointment at this clinic. Then maybe you can plant a seed around flexibility and also getting an appointment, with the psychiatrist that has a long wait, right? It's that kind of thinking of how to either say one of these because it seems to be true of that person, and then very importantly, eliciting, what do they think? How have they been brave in other situations? How have they used their creativity when it comes to, solving the issue of how to fit exercise in their day? It's that kind of planting of a seed. Now, if you have someone that you don't know very well, and it could seem very disingenuous to say something like this because you don't know them, you might give them a list like this and say, as I work with people, I'm thinking through changes that are going to work for them. I sometimes give them this list and ask them, what is an attribute or characteristic of you so that I can better get to know you and, what jumps out? And then the person might say, I've been very persistent. And then you ask them, in what way, right? Another open-ended question. And then you kind of keep that in your mind as you're thinking through and talking with them about making some kind of change and see if that persistence doesn't either make its way through, or you ask, how might you use that characteristic of persistence to follow through on this? And, with people that maybe don't always get a lot of positive acknowledgement, people that have experienced a lot of trauma, or, are just not in a position where they have that time to self-reflect, these can be very powerful types of things to say in an encounter. Okay, so the third and most important of the ORs is reflections. Reflections are, it's really being in the moment and saying back what you heard, because then the person hears themselves twice. So they say something and you say it back. It's like an additional acknowledgement that you were listening and that what they said is of importance and value. It's meant to be succinct, and it isn't meant to just always be saying back exactly what you heard, because then they'll say, you're not telling me anything new, why am I coming to you? So there is an art to doing reflections. And when I do full-day trainings, we spend a lot of time on these. But for the purposes of today, here's some ways reflections can look. So you've got someone that says, it's really hard being the new kid in school. I don't always plan to get high. Oops, sorry. I don't always plan to get high, but sometimes it's too much work to come up with an excuse. Okay, so someone says that to you, and gosh, you're thinking, okay, this is a kid that's getting high, feeling like there's a lot of peer pressure, and the tendency is to advise them, you shouldn't be doing that, and don't you know it's bad for you? But motivational interviewing will say, just stay in that with them for a moment. And you might just say back something you heard, like, it's hard being the new kid. There can be a lot of rapport building in just allowing them to feel that way and letting them know you heard them. It's hard. Now, you might also try some other types of reflections of things you're kind of interpreting or understanding without using the exact same words. So the second example here, you don't always want to smoke pot. Now, this kid didn't say that at all, but we're kind of thinking that maybe he or she doesn't want to always do it, and this would be a way for them to feel like they could talk about not always using. So you might say, you're not always wanting to smoke pot. Now, they can correct us. They can actually say, yeah, that's actually true, or no, you didn't hear me right. But if we're building enough rapport and engagement, they can correct us, and that just helps deepen our understanding anyway. The third one here is also not the exact words they use, but it's our ability to reflect back what we are interpreting or inferring from what they said, which is you want to find easier ways to fit in. Now that's hoping, we're hoping that that's the direction that the conversation could go, because we obviously are going to try and, steer them away from a behavior that we know is not healthy for them without being so in their face and saying, you got to stop doing that. What were you thinking, right? None of those kinds of things help a person necessarily want to change. So this is a way of using their words back with them to deepen your understanding and see if that moves them in the direction of change. Okay, I think this is my last scenario I wanted to have you think through. And I know there's a lot here. So what I'm looking for is different ors of the things you learned that we might say or ask of this particular patient. So the patient says, I've been coming to this clinic for 10 years, ever since I found out I have diabetes. When the panic attacks started a few months ago, I didn't think I could handle another health problem. I'm still seeing the therapist, but I don't know if it's helping. I'm overwhelmed and just want to get back in control. And I chose this picture because this is a reminder to all of us that most people are not looking for us to just tell them what to do or to lecture them. They really do need us to help them think through what they could do differently or to partner with them to see if they want information. So I'm wondering from you, what are the types of open-ended questions you might ask in this scenario? What is maybe an affirmation you would give? You feel like you take a guess at that. What is a reflection? Lots of things we could reflect. We could reflect something exactly that's said here. We might reflect something with a little more added to it to help deepen our understanding. So I'll give you a minute to type in something you might say or ask in response to this based on some of the things you know about using motivational interviewing. So chat box responses, and certainly if you want to do the raising of your hand and have your line unmuted, we can talk through some of it too if anybody wants to use that method. And then Leah, as you're getting a few, if you want to read them off, we can hear what people are thinking.
Sure. So we got one, and he says, you've been dealing with a lot over the past decade, and it's been really hard. Even when you are feeling overwhelmed, you persist and want to manage as best you can.
Beautiful, beautiful. Even just part of that could be enough, right? So that was a nice reflection of, acknowledging you've been coming here for a decade, you've been going through a lot. Again, half the battle is just staying engaged enough with people that they want to keep working through chronic health problems or really tough changes with us. And acknowledging that this stuff is hard goes a long way toward helping them move toward change. Those are really nice comments and reactions, specifically reflections. Yeah, so, really we're not trying to make a plan, right? That is the very last step. We're just trying right now to hear them out, to ask some questions that might focus on where they might want to go with this. We might affirm if we have something we could affirm with them. Any others?
So we have Yeah, we have a few more. This one says, tell me about being in control. What does that look like for you? And then there's another one that's similar, and it says, what would it look like for you to be in control?
So nice. Now that is the definition of person-centered, right? That is not about my interpretation of being in control. Who knows what that could mean for a given client or patient? We all have different thresholds of control. We all have different experiences that bring us to a point of thinking about being in control. And it's so much more about what that means for that other person. And then we can use that information to help them think about what is going to fit when it comes to, wanting that control back. That is real nice, real nice. I like that.
And then we have two more. This one says, you seem like you've been proactive in addressing your diabetes for a decade. The panic attacks are a new issue, but you're motivated to feel better. And then the
Nice.
last one says, it sounds like you have been assertive in addressing both diabetes and the panic attacks. Understandably, you want relief from the anxiety. What have you been doing to address the panic attacks?
That's great. So assertive, you've been assertive is a nice affirmation in there, right? Now this person didn't come in, walk in the door and say, I've been very assertive. But we're listening with that intent of understanding. And so we might use a word like that and say, sounds like you've been really assertive. And they can say, well, not really, or gosh, I hadn't thought about it that way. But we're seeing the positive, or we're seeing the opportunity and the strengths, if you will, that could help this person start to think about how they could use that assertiveness to manage what they say is yet another health problem. And acknowledging, the diabetes is something you've been working on a long time, panic attacks are more recent, and allowing that other person to think through. And then we can figure out, right, readiness, because maybe the response to some of these things are, gosh, yeah, I hadn't thought about it that way, or yeah, that's all true, and I really need some ideas from you now. Those are different examples of readiness, and if we just jump into, okay, here's what you're going to do to solve it, we're not really helping them or partner with them because we're kind of rescuing or fixing. And that's obviously a tendency in healthcare because we don't have a lot of time. We are experts and we do see people with panic attacks and diabetes, and we want to help fix and, problem solve. But this is all about partnering with them to do that so that it's change that they want to make and that will stick. Thank you for those. I'll keep going since we just have a little bit of time left. I don't think I have much left anyway. So ORS does end with an S, so the last of these 4 strategies is summarizing. And this can be useful if, we got that paragraph basically from that patient and we've given some reflections, and then maybe we're stuck, or maybe the client is stuck. It's an opportunity to say, before we move on, let me make sure I got what you've been saying. And then we briefly summarize. We don't necessarily regurgitate everything we heard, but we mindfully kind of link or transition or collect key things that we heard, that we think, that we heard so they feel heard, and could potentially pivot us toward next steps. So, I heard you saying this and this and this. Is that where you're at? In fact, just remembered I had an example. So it's kind of this structure. Let me see if I've got what we've talked about so far. And then you summarize. Couple of sentences. You want the problems to go away. You don't think X treatment or whatever has been helpful, and you want to find another solution. Now, maybe they never said they want to find another solution, but that's assuming that they're here because they do want something else, and it's empowering, hopefully. And then we end with something like, where does this leave you? Or what could be a next step? Or what are you thinking now? Any one of those kinds of transitional questions or statements gives you a feel for their readiness to make a plan, to get your advice, to go back and think about it some more. So if you say, what's your next step? And they say, well, I think I'm going to do X and Y. Wow, they've basically made a plan. If they say, I don't know, I'm just so overwhelmed, they're not ready for that next step. And you might have to back up and say, okay, let's think about, as someone said earlier, the pros and cons. Or what have you already considered? Or would you like some information? I have some things I could share with you. but it's really giving them the ability to make that decision about where they want to go next. Okay, so with that, I wanted to leave, it looks like about 5 minutes for questions, comments, reactions. I really welcome any insights or thoughts that you have either through the chat box or we can unmute phone lines. So we'll take a few of those if you have them, and then we'll give you some information about the next webinar.
So Pam, we haven't gotten any questions yet, but we can give it a few more minutes.
Okay. Yeah, and you know, I'd love to hear, you know, things like, what do you do about this though? Or, yep, this all sounds good, but it's harder when this comes up. Because the next webinar is Motivational Interviewing Part 2, where I'd like to go a little deeper into change talk and how do we really, you know, think through a more complex scenario and how we help someone move toward change. So, you know, hearing what kinds of things make this more difficult, hearing scenarios you run into would help with building that next webinar so it really fits for you too. The date and time for that next one. So feel free to add to the chat box, you know, working with teens, or, you know, these clinical conditions, or sometimes I get questions about groups, or, you know, medical concerns, you know, lots of different things we can add to the next webinar or maybe even touch on now. And if by chance you're only listening by phone and don't see the slide, the next webinar is June 19th. So 2 weeks from now, again on Monday, from 2 to 3 Mountain Time. Any other questions or comments, Leah?
No, we've gotten a few people saying thank you, and they really appreciate the information, but no other questions.
Okay. Sounds good. So yeah, the next one we'll do a part 2, and again, we'll want to make it interactive. And certainly if you think of things that would apply, that would help you with furthering your motivational interviewing work, I'm sure you hear from Leah and have her email address, or Joan's. I'm happy to take those following the webinar too, so that we make it as useful and practical as we can. With that, I thank you for your time today, and thank you for allowing me into your world a little bit as I thought about preparing this and what it's like to do motivational interviewing in busy settings, trying to do more integration. And we will see you or hear from you in 2 weeks.